So my symptoms started in January. It started as chest pain, and then from there it began with tics and kind of like seizure-looking episodes, and it affected my entire body, and I wasn't able to go to school, and I really didn't get any answers until I finally lost my memory and wasn't able to talk, and all of my cognition was gone, and then I was finally diagnosed. My symptoms were happening multiple times a day when they first started. I would say about every couple hours, and they would last anywhere from 2 minutes to an hour. They just kind of took over my existence. The most helpful part of treatment for me was probably being able to realize that I was able to control my FND. When my tremors first started, I would do the opposing response to them, which was doing large movements. Those consisted of like when I was having a tremor in my arm and I was shaking like this, to kind of overpower it and do big arm movements like that, or just kind of like getting up and finding a way for me to occupy myself other ways. When I had cognition issues, a lot of times I would just do everything I could to ignore them and not question myself and have others question me as well. When I was having difficulty with speaking, or I was trying to vocalize in a different way, I would kind of override that and try to make a different noise that my body wasn't telling me to make. So if my lips wanted to buzz, I would maybe start humming so that my lips wouldn't be buzzing, but I was able to still make a noise, and that was a really big part of retraining that. Once I started my plan, I was able to kind of retrain everything in about 3 weeks, but it definitely got worse before it was able to get better because it was a huge change from what I was kind of doing before. I haven't felt like I was gonna have any episodes, and overall I feel like I am back to what I may have been before, if not an even better version of myself.